Hi, my name is Adriana, and today I'm going to show you how to do trach suction and trach care. So first I would make sure that she has an order for a trach, and once I do that, I would gather up my supplies. I would enter into the patient's room, do PPE and hand washing. Then I would identify the patient through her name and her date of birth on her ID band, and I would also ask her, as well as introduce myself. Then I would close the door and the curtains, and I would tell the patient what we will be doing. I will explain how the procedure is going to go, and if they have any questions, then I would feel free to answer. Also, at this point, I would let her know that she can raise her hand if the suction or the procedure ever becomes like too much, too painful, to raise her hand and please let me know. So once I do that, I will assemble my equipment. Okay, so once I'm done assembling my equipment, I'm going to put her in a semi-Fowler position. So I'm going to raise her up to around elbow height. Okay, and I'm going to raise her up 45 degrees. Alright, I'm going to lower the side bar. Okay, so just to inform you, this will be her oxygen source for today. We didn't have the proper thing, so this will be it for today. Also, we have already hooked up her ventilation to the oxygen. That's done. Now I'm going to be putting on my gloves. Okay, so now, before I start, let me just put a check on her, making sure that she will stay clean. Okay, now I'm going to be checking the suction. So for an adult, it should be at 150, so then I would make sure that it's at 150. Okay, now I'm going to take this off, put it aside, and I'm going to make sure that it's suctioning. Okay, the suction is great. So I'm going to have it in a ready position for what I'm going to need to do. Now I'm going to be taking off my gloves. Okay, so now I'm going to set up my kit. I will make sure that it's clean, it's closed, and that it's not expired. Now I'm going to open it, pour out the contents. Now put this in the trash can. I'm going to ensure that I only touch the outsides because the insides is sterile. Okay, so got that. Now I'm going to open my saline. I'm going to lip it because it's already been used. And now I'm going to put some in here. I'm going to close it. Now I'm going to open up my sterile gloves. But before I do that, I want to put my goggles on because these are not sterile. And also I will put on a face shield or mask, but I already have my mask on, so I'll be using this mask for today. Now I'm going to open my sterile gloves, making sure to only touch the outside packaging. I don't want to touch the inside. Okay. Seems a little tricky. Okay, and then I'm also going to open this, make sure that it's clean, that it's closed, and that it's sterile. It's not open and it's not expired. And actually, I'm going to be putting my saline in here because I will use it later on. Okay. So now I will put on my gloves. Okay, this thing is getting extremely difficult. Okay, I'm just going to have to do my best. Okay. Okay, so now both my gloves are on. I can fix this one. Okay, now I'll be getting the tubing out of the package because both my hands are sterile. I'm going to grab it with my dominant hand. Okay, now I'm going to put this away. Okay, so now with my clean hand, I'm going to grab the suction tube and I'm going to connect it, making sure that it doesn't touch my tube because I don't want to contaminate. Okay, so I'm just gonna ensure that this suction is working. Okay, I know it's working. So at this point, I would remove the oxygen so that I can begin to do the trach. So I'll remove it and get this ready. So I need to make sure that like when I do it that it would be done. Okay. So I'm gonna grab this and I'm gonna do this. I'm gonna cover it with my clean hand. I'm going to dip it in here. Now I'm going to remove this. I'm going to do the suction and now don't want to keep it in too long. Okay, now I'm going to take it out, pump 3 breaths. 1, 2, 3. And then I'm going to cover this. I would encourage them to cough. Now I'm going to cover my suction. I'm going to clean this. I'm going to remove this. And I want my thing to go suction in and out. I will do that. Now I'm going to do 3 more breaths. 1, 2, 3. Encouraging her to cough. Okay. Now I would cover this. I would clean it again. I would shove it in, making sure to turn it, making sure I'm doing the suction on and off. And then I would encourage coughing and deep breathing. And do 1, 2, 3. Okay. Now I would remove this and I would put her oxygen back on. Now that we're done with this, I will sterilize it one more time, making sure to cover this, it's not suctioning, and then I will clean her mouth. Okay, so now I'm done with this and I'm going to take it off with my gloves. I'm going to wrap it up in my sterile hand. I'm going to remove it from the section. Now I'm going to take off my gloves. Now I'm going to dispose of it. Okay, so now that I'm done with that, I am going to prepare to like clean the suction or clean her trach. So the first thing I would do is put on my gloves. No, I would not put on my gloves. I would open up my sterile field so I could begin to clean the trach. So I already pre-opened it already, so next I would open up my sterile gloves. Okay, again, my hands are sterile, so I would adjust this. Okay, so now I'm going to take this off. Her oxygen. Okay, now with my clean hand, I'm going to do a twisty motion. Okay. With my non-dominant hand, I'm going to hold it. With my dominant hand, I'm going to do a twisting motion and take it out. I will dispose of it. Okay, and then I will open up a clean one, making sure that it's not dirty, making sure that it's clean, and that the packaging is not expired. Okay, so now I'm going to put it in. attention. Okay, now I'm going to grab my cotton swabs with my clean, with my straw hand. Okay, I'm going to dip my swabs in saline, and I'm going to do this in 4 quadrants. So, making sure to keep it on, hold it. Oh, and I would put her oxygen back on just because I don't want her to pass out. Then I throw it away. Do another one, dip it in saline, clean another quadrant. Dip it in saline, clean another quadrant. Saline and clean this other quadrant. I would have removed the gauze, but she didn't have one, so before I did any of that, I would remove it. And now would be the time that I would place a new one on. Okay, so let me remove this. And before I do that, let me dry it for her. Okay, now I throw that away. Okay, now I'm going to be inserting a new one. Okay, so now that that's done, I would put her oxygen back on. Now I'm going to replace her collar. So I would grab it before I begin to, and before I put that on, let me remove my gloves. Okay. But let me put on these gloves. Okay, so now I'm going to be removing her collar. So I just want to take like one side off at a time, making sure like the whole thing's not loose. So first I'm going to remove this side. Okay, now I'm going to insert the new one. Meanwhile, I want my non-dominant hand to like really hold down the trach plate and like make sure. Okay, so I'm going to pass this through the patient's ear. Okay, now I'll be removing it on the other side. Okay, again, just making sure that my non-dominant hand is really holding it down. Okay, and now that's done. So now I'm done with her trach care. I'm done with everything that I need to do. Now I'm gonna clean the area. So I would clean all this up. I would take off my gloves. Then I would lower her bed till it's like all the way to the floor. I would make sure that she's okay. Then I would remove my PPE and wash my hands.